let's mark that page as Exhibit 3. Why don't you pull it off and just...
We'll put a number on it?
No, that's what for the court reporter.
Let's see, the doorway was over there, so that's it.
Here.
Yeah.
It'll at least help him look at it again.
Yeah.
Okay. Now, how long after the second meeting on the 26th started did you have this conversation with John? Did you start sitting knee to knee with Mr. Mosley?
Within the first 15 minutes.
Okay. And what happened after you sat knee to knee?
I showed him the bottle of EPO, which had an EPO label on it. And one of the things that we talked about, and Shane had concerns about, was there enough time for this to work before the fight? And I explained to him that if he used what they call a double saturation method, which means the little bottle of EPO contains 1 cc that has 4,000 international units. If you take half of it and you put it in one injection site, 2 to 3 inches on the right side of the stomach, and then you pull the needle out, and then you inject it 2 to 3 inches on the other side, and you create 2 saturation points, that it seems to, the drug seems to have a greater effect by using this particular technique.
So half on one side and half
on the other. And I explained, all the steps of that you turn the bottle upside down, you draw out the 1 cc in an insulin syringe, you have to hold it in one hand and flick the cylinder with your finger to get the air bubbles to go to the top. And then you push the stopper up until all the air comes out, so you're not injecting air bubbles.
Did you explain to him that if there was any danger about air bubbles?
Yes.
What did you say?
That you want to get all the air out because that can create problems.
What kind of problems did you tell him?
Well, it's not like getting an air bubble when you're doing intravenous, because this is subcutaneous, but it could be painful, or it's not going to kill you, I wouldn't think, but it's not like an air bubble going IV, which would have significantly greater damage. And he did the 1 injection, and then he did the 2nd injection, and I explained it to him, and he held the bottle in his hand and came through the rubber stopper on the bottom, and the specific brand that he used was called Procrit, and very clearly right on the label it was identified as being EPO.
Okay. Are there any legal uses for EPO?
The medical indications are patients with chronic kidney failure that are on renal dialysis, HIV patients, it's really anybody that's anemic.
Okay.
Cancer patients.
Now, after he filled the syringe, what did he do?
He got rid of the bubbles and pushed a little bit. Drop came out the top, and then he pinched some of the skin, and then he made the first injection.
And did he do 2 injections?
Yes.
Okay. After he did the 2 injections, what happened next?
Then I believe we talked about the administration. We moved on to the clear.
Okay, and what was?
And both the clear and the cream came in 7 cc plastic vials that had a screw top lid. There was approximately 3 cc of liquid in it, and I explained to him that we used a insulin syringe without a needle. And it was strictly to be used as a measuring device. So he would stick the needle down inside the little vial and draw up into the the syringe. The target that he was to use was 30 units, so each syringe holds approximately 100 units, so about a third full. And then he would turn it sideways and hold the bottle across, and then say there's 60 units because he pulled too much in, and then to not only, once again flick it to get the air to come to the top, and then push across and let it go, the remainder, the excess, go back into the tube, and to, once he pushed it down to 30 units, then that would be the amount that he would take. And understand that these vials had no labels whatsoever. They were just clear vials with no sort of notation, no label. It was, just a clear plastic vial. And then he was instructed to squirt this material under his tongue, and the idea was sublingual absorption to go directly into the capillaries as opposed to swallowing it and going through the gastrointestinal tract, and to leave it there for a couple of minutes before swallowing whatever remainder to try to maximize that absorption through the capillaries under his tongue.
Did you explain that to Mr. Mosley?
Yes, I did.
You told him about this sublingual?
Yes, I did.
Okay. What you just described, you told Mr. Mosley?
Yes, I did.
Did he, in fact, use the clear in front of you?
He administered it right in front of me and Daryl and Jim, yes.
Okay. And after that, after Mr. Mosley administered, according to you, the clear, what happened next?
I talked him through how to administer the cream, but you don't do them on the same day, so he was to do that the following day, which was on Sunday. So I showed him basically how you do it, that it came in the identical type unmarked container, and there was a little 1/2 gram white plastic spoon, and he was to dip it inside and to take it out and then turn it over and scrape it across the top where the excess fell back in, so he would have exactly 1/2 gram of this cream. And I told him that he could either rub it directly into the area where he would have his blood drawn. There's lots of capillaries right here, or if he preferred, that he could do it behind his knee, because there's also lots of capillaries, and you get the transdermal absorption is very good there, so whatever was his preference. But he did not take that there in front of us that day. He was instructed to take that the following day.